So we have Kelly with us today. She's 1 week out of eyelid surgery. We did upper eyelid surgery in the office. We did a blepharoplasty or skin fat removal. And we did ptosis repair where we're tightening the eyelid muscle. So Kelly, tell us, what brought you in for eyelid surgery?
About 3 years ago, I noticed that one eyelid was droopy. And that's when I first became aware. And, once you notice it, you can't not notice it. And so over time, every day of my life, for the past 3 years, it just became a nuisance. And I knew I had to do something about it. I started researching my options. Someone referred me to you. I was really impressed at our first meeting. You answered all of my questions and you put me instantly at ease. And I was really nervous about an in-office procedure, as I knew that was one of my options, and it really made the most sense financially. You reassured me that it's actually quite easy and it's not painful. I'm here to say that's true.
Wonderful. I'm glad. Tell us in that first consultation, what can patients expect? How was your consultation experience?
It was great. I felt like it was very thorough. You performed an eye exam. I had some questions and you were very thorough with answering my questions. And like I said before, it really put me at ease. I had met with another doctor before and that wasn't the case. And so I really walked away feeling confident in your hands.
In Kelly's case, part of her procedure was functional or medically necessary. So the eyelid was so droopy that it was blocking her vision. So after our initial consultation, we also had her come in for a visual field test. So that's where we're basically trying to prove, how much is this lid blocking the vision? And we do it with her relaxed and then with the eyelid taped up. And we show that improvement for the insurance companies. So tell us about nerves, before surgery and especially the in-office surgery experience.
A lot of nerves, a lot of anxiety beforehand, but decreasingly so as I approached the date. Because initially, just the idea when you think about a doctor operating on your eyes, while you're awake, it's a lot. And I found it terrifying. But I had the option. I could do it in the hospital. I did not want to pay an additional $2,000. I can do a lot with that money. And you assured me that it's really not that bad. And I was talking to some other people and they had that same experience. They were saying it's for some reason it's not. With research, with talking to you, I decided, I'm going to do the in-office procedure. I'm just going to have faith in the process, and I did. And I would encourage anyone and everyone to go that route. It was incredibly easy, and it's almost a surreal experience how you're not fully aware, because I think when you haven't had it done, you assume that you're going to be hyper aware of everything that's happening, but you and your team did a really great job of talking to me and talking to each other, and I found that as a good distraction. Also with just a Valium, it was enough to calm my nerves and really allow me to have the procedure, and it was just so incredibly easy. If I could go back in time and just tell myself, it's gonna be fine.
You did wonderfully. So exactly what you said, first of all, we have a really great team. We're really lucky with that. And then we just prescribe typically Valium ahead of time. Patient takes it maybe about an hour before the procedure. And then we are, of course, numbing with local numbing medicine. And those injections can sting a little bit, sting and burn, but then we can continue to add as needed. How's the recovery experience been? So right now you're only just 7 days out of surgery.
Yes.
We definitely see a little bit of bruising right out here, but tell us about the recovery.
It's been great. No pain. There's been zero pain. I haven't had a single moment with pain, which is another surreal experience. You fully expect to have some discomfort. There really hasn't been any. I follow the rules. I iced on a regular basis, used eye drops to keep my eyes from getting too dry. And I did sleep propped up, which that was the most discomfort I experienced. Just sleeping at night, having to be propped up. And if that's the worst thing that happens, it's pretty good.
Good. Yeah. And not all patients have to be propped up, but we definitely don't want people's stomachs sleeping. We don't want you to rub those stitches and pop the stitches. We don't want you even, side sleeping and things like that. So like you said, you're a rule follower. So your recovery has been really well because you've been doing that as well.
Yes.
So was there ever a wow moment where you're like, okay, the surgery worked? I see the difference.
Immediately. I did see a difference immediately. And of course there's still swelling. And so I'm just trusting the process. I have faith, but I was happy right away. Absolutely. Absolutely.
How about with your family and friends? Has anyone seen you, or have you been in hiding, or how has their reaction been?
I have not been in hiding, but I've been out in public. Basically, starting the next day, I did go out with sunglasses. I did not go anywhere without sunglasses, but I was able to work. I was able to have dinner out. Mother's Day was, just that weekend after, and we went to dinner. We went to the movies, and I was able to do all those things.
Any advice for another patient looking to have eyelid surgery, specifically in the office? Any other pearls?
I would just encourage people to have faith in you in particular. I think you're a very easy doctor to have faith in, and I appreciate that because I've had a lot of experience with doctors over the years, and they're not all great experiences, but it's been a pleasure working with you, and also trust the process. It's true. I don't know why it's like magic, but it's an easy procedure in office.
Would you recommend, for someone to come to our facility to work with our team again?
Oh, 100%. And I will absolutely be back because, there are some other things I would like to do, possibly a lower. I don't know, but I will definitely be back.
Thank you so much. So, today is 7 days out, so we'll be removing the stitches from the upper eyelids, and then you'll be continuing the ointments, and we talked about activity limitations for another week. So it is kind of 2 weeks after surgery to make sure that we're not doing any strenuous exercise. We don't want to open our incision line. So we'll take care of that. Thank you for your time.
Thank you.